Hello, and welcome to today's RISE-Cast, where we share tips for improving immunization rates from Rise to Immunize campaign participants. Today, we'll be hearing from Meredreth Maynard, Director of Ambulatory Quality at Utica Park Clinic in Tulsa, Oklahoma. Thank you so much for joining us today.
Thank you for having me.
Please start by telling us a little bit about yourself and your organization.
So I am the Director of Ambulatory Quality here at Utica Park Clinic. We have over 80 locations across Northeast Oklahoma. We're part of a larger health system that includes 8 hospitals, and also are partnered with our other physician group, Oklahoma Heart Institute. We have about 60% primary care in our health system, and so addressing the adult vaccination opportunities is especially important to us.
Well, thank you. I understand that Utica Park Clinic holds an annual vaccinations training leading up to respiratory virus season. Please explain who attends this training and what is the purpose?
Of course. So about 7 years ago, we recognized that we have a lot of maybe new staff or even staff that had been on board for a long time who maybe had some misconceptions about flu vaccination and including pneumococcal vaccination and just administration tips to recommendations to which formulas to use. And we also saw quite a high rate of medication administration errors. So we really wanted to put something together that would address those things and set them up for success for the flu season, as well as help promote flu vaccination with the appropriate populations. So we invite all of our clinical staff, including medical assistants, nursing staff, LPNs, and RNs, providers, also our clinic managers. They're not necessarily providing the vaccination, but they really set the tone in their clinics and the culture, and we want them to be on board with how important this is so that they can also answer questions or understand what the processes are. And then we also have a lot of community flu vaccination drives, so we'll partner with businesses or organizations and be out in the community administering these flu vaccinations. And so a lot of staff that typically aren't doing vaccinations during the year are asked to go and help with these events. So this gave another opportunity for them to participate in some learning before they went out, if it had been a little while since they'd been doing those things. As far as the objectives, we want them to understand why vaccination is important, but we also want them to be able to educate others, whether it's their coworkers or their patients, or maybe even their providers, on the current flu season and which individuals are at risk, the current recommendations, and also what formulations are available. We know that those change a little bit every year, and also the ones that we carry on hand.